Good morning, doctors. Today we are going to discuss here about INI-CET recall MCQs for pathology June. It's July 2021. Let's begin. Event within the minutes of inflammation, histamine releases. So, what happens when event of inflammation minutes? So, best answer here is there is histamine release, neutrophil, prostaglandin release, leukotriene, or mast cell activation. So all options are absolutely right here because when inflammation occurs, we see histamine release, neutrophil, prostaglandin release, leukotriene release, and mast cell activation. So all options are absolutely right here. Now, HPV produces protein suppresses RB gene. So, which one is it? So, how to remember this? This is answer here is E7, E7, and E6. Remember P R. So P53 for E6 and RB is for E7. Okay, so now next question. 60-year-old man, low back ache, hemoglobin 7, it's anemic, calcium 13, it's hypocalcemia, and creatinine is 2.3, thoracic vertebral fracture, urine protein is 3 plus, diagnosis cause of this renal failure. So guys, this is absolutely a sign of crab. What is crab? C for hypercalcemia, so 13, R for renal failure, A for anemia, hemoglobin 7, and B for low bone pain or backache, and here is for vertebral fracture, thoracic also. So this is a answer here is multiple myeloma. Okay, now the effect of G6PD deficiency. So all options in front of you. In case of G6PD deficiency, we see decrease in NADPH level and decrease RBC membrane damage. We can say in hereditary spherocytosis we see membrane disorder, or we can see but here in and there is a decrease in NADPH level. Okay, about RNAi true is, so RNAi, it represents knockdown. Okay, now immune checkpoint inhibitor nivolumab used in, so this one is mainly useful in case of Hodgkin's lymphoma, okay. Now arrange steps pap smear in correct sequence. So firstly, retract the vagina, first step. Second one is take a smear, and third is make a smear on slide, and fourth is fixation. So all four steps same. Now flow cytometry represents by, so flow cytometry is mainly represented by histogram and dots. Best method to assess HbA1c levels. This is previously asked question, so many times they like to ask. So if you want, you have to answer in comment box. This is a case of affinity chromatography. These levels are assessed best by affinity chromatography. Now regarding tumor suppressor gene, correct is BRCA1 is an oncogene. No, this is a tumor suppressor gene. EGFR positive for non-small cell cancer. Yes, for adenocarcinoma, this one is true. HER2 new amplification in fraction of breast cancer. So this one is also true. And MYC is tumor suppressor gene. No, these are oncogene. Okay. Now most typical manifestation of juvenile dermatomyositis is, this is also previously asked repeated MCQ. So best answer is Gothard papule. So answer here is Gothard papule. Malar rash in SLE, photosensitivity in SLE. Okay. Now origin of CLL and small cell lung small lymphocytic leukemia or chronic lymphocytic leukemia is by nerve B cells interfollicular area. So the best answer here is nerve B cell in interfollicular area. Now 20-year athlete suddenly collapsed and died. Diagnosis sudden cardiac death based on autopsy causes. This is image based MCQ. Even this MCQ I already discussed in my clinical based MCQs of cardiology, if you see. So this is a case of sudden cardiac death due to HOCM, hypertrophic obstructive cardiomyopathy. This is not a case of atherosclerosis, not valvular heart disease, and this is not a arrhythmia. So the most common probability here is HOCM in youngsters. Treatment of Sederoblastic anemia. This also I explain in my lecture Sederoblastic anemia in Hindi, where I explain. So in case of Sederoblastic anemia, we give pyridoxine, it's vitamin B6. Okay. Now fixative used in pap smear. In pap smear, we are going to use 95% ethanol, and formalin is used for HP histopathological examination. Okay, in biopsies. Now cell mediator now cell mediator response for delayed hypersensitivity. This is also previously asked MCQ. So the best answer here is cytotoxic T cells. If they ask more than one, then macrophage is also right and dendritic cell is also right, but IgG4 is not true. Now irradiation blood cells prior transfusion prevents which of the following? This MCQ also I discussed in hematology clinical based MCQs. So this is responsible for best for graft versus host disease. Okay. Now arrange cellular events of inflammation in a right sequence. In right sequence, what happened? Firstly rolling, then stabilization adhesion, then cytokine mediated integrin and activation and endothelial migration. So 1, 2, 3 and 4th. Okay. Now RNA based sequencing technique is for Western blot is for protein, and G bending for chromosome analysis, and we can say Sanger. This one is for DNA, or Southern blot for DNA, Northern blot for RNA, but RT-PCR is a technique. So best answer is for RNA based sequencing technique is RT-PCR. Now proptosis in a child, Desmin positive tumor diagnosis is by, so Desmin positive tumor is embryonal rhabdomyosarcoma. Now patient present here, a lesion is nasopharynx, chronic sinusitis, nodular lesion. So nasopharynx nodular lesion, triad I already explained in rheumatology section. I discussed this MCQ. So first one triad is chronic sinusitis, upper respiratory tract involvement, and cavitation in lung, it's lower respiratory tract involvement, and the best investigation for renal failure, it's renal. So all three triad represents, this is a Wagner's, and in Wagner we see C ANSA is positive. So this is a case of ANSA for vasculitis. This option is ANSA for vasculitis, C ANSA, and in Chog-Strauss there is P ANSA. Okay. Now Chog-Strauss is what? Asthma with all Wagner features. Okay, not a feature of PNH. This already I delivered lecture in English and in Hindi also. In PNH features we see thrombosis, aplastic anemia, hemolysis, but in later cases it can convert into leukemia also. If they ask not, so the most suitable answer here is there's all leukemia. So best answer is leukemia. They are asking not. Now cell mediators involve early part type 1 hypersensitivity reaction. So the best answer here is mast cell, histamine, prostaglandin. If more than 3, all 3 are answer, but neutrophil is not included. So guys, if you like my video, please put like on it. If somebody is new on my channel, please subscribe it. Thank you. Good day, goodbye. That's all.